Hey there, everyone. Today, we are diving into a truly fascinating and somewhat unsettling story that has me thinking deeply about the complexities of modern medicine and the potential risks we face. The case of Caroline Savage is a tragic one, and it raises so many questions about our approach to healthcare, especially when it comes to weight loss treatments. So, let's get into it. Caroline Savage, a 73-year-old woman from Norfolk, was privately prescribed a weight loss medication called Mounjaro. This drug is known to have gastrointestinal side effects, which, as we'll see, played a significant role in this tragic turn of events. Now, here's where things get interesting. Caroline had been taking Mounjaro for a few months, and it seemed to be working. She had lost some weight and was feeling better overall. But then, a fateful decision was made. She was advised to increase her dose. Shortly after this increase, Caroline experienced sudden and severe abdominal pain, which ultimately led to her untimely death. An inquest into her death has been examining the potential link between Mounjaro and Caroline's tragic passing. But here's the twist: her family, including her husband, a long-serving local councillor, has raised concerns about the treatment she received in hospital. They believe that doctors may have been too quick to attribute her symptoms to the drug, potentially overlooking other critical factors. You see, Caroline had a medical history of lipoedema and lymphedema, conditions that cause fat buildup and swelling in the lower body and arms. She had struggled with weight loss through traditional methods, so turning to a private clinic and a prescribed medication seemed like a reasonable step. But the consequences were devastating. The drug's side effects, including abdominal pain and constipation, were well known. In Caroline's case, these side effects may have been exacerbated by an underlying condition called diverticular disease, which affects the intestine. The drug's mechanism of slowing down the movement of food from the stomach to the intestine could have increased pressure in her intestines, leading to inflammation and ultimately perforation. A post-mortem examination revealed that Caroline died from fecal peritonitis, a leaking of fecal matter into the abdominal cavity, caused by the perforation of her intestines. This tragic outcome has left her family and the medical community questioning whether enough investigations were carried out before she was discharged from the hospital. The inquest has also focused on record-keeping, communication between clinicians, and the potential impact of morphine on the assessments of Caroline's pain. Her family argues that she was discharged without a proper diagnosis and that further investigations, such as a CT scan or a surgical review, should have been conducted. Now, here's where it gets even more thought-provoking. The family's barrister has submitted that Article 2 of the European Convention on Human Rights, the right to life, should be engaged due to potential systemic failures in communication, documentation, and clinical decision-making at the hospital. This is a serious allegation and highlights the broader implications of this case. In response, the hospital's solicitor argues that Caroline's death was from natural causes and that the high threshold for engaging Article 2 has not been met. They accept that record-keeping could have been better, but maintain that appropriate clinical pathways were followed. As I reflect on this tragic story, I can't help but wonder about the balance between trust in medical professionals and the need for thorough investigations. It's a fine line, and in this case, it seems that the consequences of not crossing that line thoroughly enough were devastating. So, what are your thoughts? This case raises so many questions about our healthcare system, the responsibilities of medical professionals, and the rights of patients. It's a reminder that, while we trust our doctors, we must also advocate for ourselves and question when something doesn't feel right. I'll leave you with that thought as we continue to explore and learn from stories like these. Until next time, stay curious and keep those critical thinking caps on.